Tonight, Riverside County plunged to 0% capacity for ICU bed availability. The entire Southern California region isn't trailing too far behind, standing at 2.7%. News Channel 3's Shelby Nelson is live for us tonight at Eisenhower Health with more on what that means for our local hospitals. Shelby.
Well, Karen, when you see 0% ICU bed capacity, it really sounds like there are no beds available. But county health officials did clarify that today and explained exactly what that means. A lot of hospitals, however, have been really seeing these ongoing issues, and that number really just indicates a lot of them are going to have to tap into their surge plans.
This is the kind of thing that happens in a disaster. If this were a major earthquake or major catastrophe, it's time where everybody's getting creative to try and find ways to meet the needs.
Meeting the needs to work around an ICU bed capacity now plunging down to 0%.
They've been rising steadily for the last month, but now we believe we're starting to hit our Thanksgiving surge.
Coronavirus cases spiking even worse than what we saw this past summer. At the mid-year peak, there were 550 hospitalizations. Now that number is just short of doubling. But the question, does that mean there are no ICU beds available?
There are some hospitals that are in the 90s and some a little more than 100, so that's where you get your zero from. So there are ICU beds available.
In a Monday briefing, county health officials said dipping down to 0% means many of the county's 17 acute care hospitals will now be activating their surge plans.
Fortunately, this is one of those things that we planned for and didn't happen in the first wave.
Shane Reichart with the county's emergency management department says each hospital has its own plan.
Do things like cancel elective surgeries. They may be transferring patients who are done with their time in the ICU into other beds.
A spokesperson for Desert Care Network tells News Channel 3 some hospital rooms are being converted to make way for ICU patients. One of the biggest challenges across the board is having an adequate amount of staff.
We're getting staffing requests and other requests from pretty much all of the hospitals within Riverside County, including the Coachella Valley.
Eisenhower Health Chief Medical Officer Dr. Ellen Williamson provided this statement. We have additional areas designated in the hospital where we can manage ICU patients as part of our surge plan and continue to work diligently on augmenting our staff to be sure we can care for the additional patients. We did receive some additional nurse resources from the state pool, which will help. The county is helping forward hospital staffing requests to the state. Now, we've spoken a lot about the federal medical station being a backup, but when I asked about that, a county official tells me that it really wouldn't make sense because it is a lower level care facility, and right now they are experiencing staffing shortages. So designating staff for that just would not make sense at all when they need all hands on deck for higher level care. In Rancho Mirage, I'm Shelby Nelson, News Channel 3.